Hello, I am Dr. Andrew Doan, a board-certified ophthalmologist. Have you wondered if eye drops can be used to cure cataracts? Can we use breast milk to get rid of pink eye? Will eye exercises cure your needs for glasses? In this video, I will answer these questions and talk about the 8 internet eye fads that can potentially be dangerous. The first eye fad is eye yoga. So eye yoga has been being spread throughout the internet and social media as being the cure for refractive error or to get rid of your glasses. So I'm gonna flesh this out with you. Let's watch this video together and then I'll explain more. This man promises that if you do these eye exercises, that you'll get rid of your glasses. So these exercises consist of moving the eyes left and right, up and down, diagonally. So you have 6 muscles to the eye, and we do this all day as we work, we play, we go to school, we read, we drive. You're moving your eyes around, and this is nothing different than what you do throughout the day. This last exercise is really eye push-ups, and we do use this. We use this for people with accommodation insufficiency, those who are having trouble with bringing the eyes together to see near. And so we can try eye push-ups to try to get the eyes to focus at near and to work together. So that is a legitimate use of eye exercises. But unfortunately, it's not going to get rid of your glasses. So the way the eye works, this is the front of the eye. Light travels through the cornea, through the pupil, through the lens, and then it goes to the back of the eye. Here, as light travels through the pupil, it goes to the back and it has to focus on the back here, which is the retina. Unfortunately, when you have a need for glasses, you either have an eyeball that is either too short or too long in average. Now, there's also astigmatism, which is a asymmetric sphere or asymmetric curvature of the cornea or the lens, causing you to need a cylinder placed into your eyeglasses. But let's just keep it simple. If your eyeball is too short, you're going to be farsighted, or what's called hyperopia. So the light is focused in the back of the retina, and you need a plus lens in order to bring the light to the retina. Now, if your eyeball is too long, you're going to be myopic, or you have myopia. Then you need a negative lens to bring the light focus, which is going to be in the front of the retina, to the back of the eye. So doing eye exercises by moving your eyes around with all the different eye muscles is not going to change the shape of your eye.
That's so not going to happen.
It's not going to change the shape of your cornea, your lens, or the length of your eyeball. So you will not be able to get rid of your glasses because you have a physical limitation that requires glasses because your eyeball is either too long or too short. So if it makes you feel better, go ahead and do it. So if eye yoga helps you with relieving stress or with eye strain, go for it. Because when I look at medicine and my patients come to me and they present an exercise or an intervention that has very low risk. So eye yoga has very low risk to the patient and to the eye. So I tell people, if it makes you feel better, either because it does, or there's a placebo effect that makes them think that they're getting a benefit and they feel better, then go for it.
Yeah, some people say they're just a placebo. Who knows?
Because the risk of a medical issue is so low that it's not worth me fighting or arguing with the patient to convince them that eye yoga is not going to help, because I know in the end they're going to need glasses anyway, or they're going to need refractive surgery, or they're going to need some kind of intervention, medical or surgical, to take care of that refractive error that they have inherent in their eyeball. So fad number 2, essential oils for the treatment of glaucoma. So this has been traveling throughout the internet as well, and people are using essential oils for everything, including to cure eye diseases and glaucoma and pink eye and other issues. So we're going to look at glaucoma specifically because this video here claims that you can actually achieve glaucoma treatment with putting essential oils onto the face. So this gentleman here talks about a vision therapy program, and he has a hashtag glaucoma, and he talks about the use of essential oil.
Carrot seed, and number 3, frankincense. Application is 1 drop of the fennel above the hairline, temples, cheeks, followed by the carrot seed layering on top, followed by the frankincense, number 3. You'll notice immediately your peripheral vision widens out. You'll notice immediately your peripheral vision gets very wide and your eyes will feel more relaxed.
So if you're going to use essential oils, don't put it into your eye, because essential oils can actually be harmful to the cornea, to the surface of the eye. It can also contain bacteria, can also cause infections to develop in the eye. So the best thing to do is basically do exactly what he said, was that if you're going to use essential oils, put it on your face, but away from the eye. Again, this is a low risk to no benefit intervention, meaning that it's not going to benefit your glaucoma, but if it makes you feel better because you smell better, you love the way essential oils smell on your face and how it's aromatic, then go ahead and use it. But don't get rid of your glaucoma medications. There is no research evidence whatsoever that essential oils will lower eye pressure, and that is the main way to treat glaucoma. And glaucoma is a disease that will permanently damage your nerves. Go get your glaucoma drops, go get your glaucoma treatment from an ophthalmologist, and basically stick with the treatment program. But use the aromatic essential oils if it makes you smell better and you feel better, because it's fairly low risk as long as you don't place the essential oils into your eye. Fad number 3, using castor oil for cataracts. There's not a dramatic effect where patients actually can see better significantly. And so also got to be careful because there's no FDA approved preparation for castor oil. So you're putting castor oil that may not be medical grade or can contain bacteria, can also be very harmful to the eye. So let's watch this video as we discuss the use of castor oil for cataracts.
One such remedy that has been making rounds on the internet is castor oil. Advocates of natural health solutions suggest that applying castor oil directly to the eyes can help dissolve cataracts and restore clear vision. But is this a fact grounded in scientific evidence, or is it merely a hopeful fiction spun from anecdotal experiences? The use of castor oil for cataracts has been the subject of several scientific studies.
Now the research is very early. I think there's maybe 1 paper on this. So it's not robust and there's not a lot of promise, in my opinion. So they're going off of 1 research paper, and the results were not impressive.
Process of continual discovery, and one study is just a piece of the puzzle. Medical experts caution that the effectiveness of castor oil may vary from person to person. Moreover, it's crucial to understand that castor oil is not a magic bullet.
But doubtful.
It won't work.
Why?
So really, it's like trying to dissolve protein imperfections in the lens by putting a topical drop on. It's very unlikely. At this point in time, there is absolutely no research or medical evidence that castor oil will work for cataracts. So do not put castor oil into your eye. If you have cataracts and are suffering from vision loss from cataracts, consult your ophthalmologist to discuss your medical and surgical options. If you're enjoying this video, please hit the like button. Fad number 4, placing food coloring into the eye. So mainly this is a fad or actually a dare or a joke that's been propagating throughout TikTok and social media and the internet and videos. This can actually be very harmful. So let's take a look at this video.
Jeff, don't spray my eye.
No, stop it.
Let me spray my own eye.
Right. Just don't finish. I'm doing it in 10.
Oh, I'm scared.
Okay,
Oh, I'm so scared.
9.
Oh, oh, it burns. Oh, it burns bad.
It stings because food coloring is not made to be placed into the eye. And so it's gonna be painful and there could be bacteria in the food coloring because this is not medical grade solutions to be placed into the eye. So placing food coloring into the eye is a bad idea. There could be bacteria, it can actually cause irritation, which can lead to infection. I don't recommend putting food coloring into the eye.
He says it's a bad idea.
Fad number 5, breast milk cures everything. So there's been a lot of rumors on the internet that breast milk can cure everything, including pink eye. Now, there's no doubt that breast milk is extremely nutritious to feed to infants. So breast milk is an important part of a infant feeding program. However, let's look at this video and we'll discuss the use of breast milk for pink eye.
Did you know that your breast milk contains white blood cells which are designed to fight infection? If your baby has a sticky eye, when you're feeding your baby, allow a little droplet of your breast milk to fall onto the affected area and the baby will blink that in. Do this several times a day and you should see an improvement.
There is a lot of bacteria in breast milk. So mothers who are placing breast milk into their baby's eyes are introducing a ton of bacteria into the eyes. And the infection that can arise from the breast milk itself will be worse than the pink eye. So keep the breast milk away from the eyes.
No, don't want any milk right now.
Fad number 6, placing Burt Bees menthol right onto the eyelids. There's a fad called Beesin going around the internet and social media where people put menthol-based lip balm like Burt's Bees onto their lid. So let's check this video out. So he's rubbing this menthol onto his lid.
He's lubing this up. James, you have a bunch on your middle finger.
Okay, bet.
Get some on your left eye. Yeah, that eye.
This?
Yeah.
Well, I'm gonna be twitching in like 2 minutes.
You got more on your finger still. Look. Put that on your other. Yeah, that one. You're gonna be dying, dude. Oh my god.
Did.
I don't know.
Alright, I'm gonna have like epilepsy in like 30 seconds. Alright, that light is killing me. Get that.
James, sit down.
Yep, he's in a lot of pain because that menthol got into his eyes. Now they're irritated, they're gonna be red. Not a good thing.
Of course I can always occasionally they notice.
So placing menthol-based lip balm onto the eyelids can cause eyelid irritation and cracking, which then can further cause infections. This is mainly used because people think that they can put menthol solution or menthol-based lip balm to help keep them awake and alert, but it really doesn't do much except causing a lot of pain and discomfort, as you saw in this video.
It isn't too late. Don't do it.
So internet fad number 7, curling your eyelashes with a hairdryer. There's a lot of internet rumors about using a hairdryer to curl the lashes. So let's take a look at this video together.
Super quick tip, curling your lashes with the 3D Fiber Lashes Plus. Yes, you can use eyelash curlers.
And I actually recommend
Definitely
using eyelash
By the way, these are
curlers.
ours. They were Kudos last month, but you can get them starting in March of 2016.
So use those are
Keep
safe.
that in mind. Another way that I curl my lashes, once I have applied, I already have my 3D Fiber Lashes Plus on. You take a hairdryer, put it on warm setting, not hot, warm setting, and excuse my beat up hairdryer, it looks awful.
So at least she's using on the warm setting so that it lowers the risk of getting a burn.
It really just lifts your lashes. It's so awesome. Let me zoom you in and do it again so you can really see what it's doing. Okay, now that I have you zoomed in, I'm gonna do this again. And again, it's on warm setting and I'm just doing it on low. It just really lifts those lashes, and it also helps separate them more so there's no clumps. It just, I believe it kind of sets my lashes, if that makes sense. I think it sets the rest of my makeup. It just sets it, and I love, love, love it. So get your hair dryer. Try it out. Love you guys. Bye.
So we definitely don't recommend using a hair dryer to curl eyelashes.
Oh, for the love of God! It burns!
Blowing hot air or warm air directly into the eye is not a good idea. It can cause eye irritation, redness, and also corneal epithelial defects, depending on how much heat and air is being blown onto the surface of the eye. And then also, there's a risk of actually having burns on the face. So just use an eyelash curler. It works well and adequately, and so there's really no need to use a hair dryer to do this. So definitely do not recommend you using one to curl eyelashes.
Seriously, all right, you look beautiful.
Eye fad number 8 is tattooing of the eyes. So this is an extremely dangerous procedure. Let's watch this video together. So they are injecting ink underneath the conjunctiva and the sclera. So the conjunctiva is the membranous tissue right above the eye itself. You see that was the second injection there. And they basically inject ink underneath. And so we do this in ophthalmology, but we do with sterile technique, and then we also inject medications that the eye needs. So essentially the ink that's being injected is absorbed into the eye. So this is an extremely dangerous procedure because essentially this is a medical procedure. So if the tattoo artists aren't trained to do periocular injections or injection adjacent to the eye and not directly into the eye, there can be serious complications and problems. When we do it as ophthalmologists, we make sure that it's a sterile field, that we use proper antiseptic technique. We also have clean needles. And then the medications that we're injecting, we know have been FDA approved to be absorbed by the eye. So we don't know what kind of ink that's being injected next to the eye. That ink is being absorbed into the tissues of the eye and into the eye itself. This could be years down the road before we know what are the ramifications of injecting an ink that is harmful. And as you could imagine, because it's not approved by the FDA, there are a variety of inks and ink mixtures and compounds. So we don't know when we get this done what type of ink or chemicals or molecules are being injected into our eye. And it could be years down the road, and some of these molecules could actually cause severe permanent vision loss. And so what other complications can occur? Well, acutely, because you see how they injected underneath the conjunctiva and the sclera, and they formed a little blister there. Well, if the needle goes too far back or it hits a blood vessel, it can cause hemorrhage. So it can cause massive periocular hemorrhage, which actually can lead to what we call a retrobulbar hemorrhage. A retrobulbar hemorrhage is bleeding around the eye into the back of the eye, and it causes increase in pressure, and actually severe vision loss can occur if that pressure is not relieved. So that is one issue. Another issue is that the ink itself could be very irritating to the membranes and the sclera itself. So there's been case reports of what they call necrotizing scleritis. So necrotizing is when the tissue gets damaged and dissolves and gets kind of like eaten up by the immune system. And scleritis is inflammation of the sclera. And there's also uveitis, so there's inflammation in the front of the eye and the back of the eye. That is bad news. When you have something that's a necrotizing scleritis caused by a chemical, in this case ink, injected into tissues around the eye, I have seen cases where that has ended up horribly, where literally the eye ends up in a jar. The other issue is that the needle, if not used by a trained professional, the needle can penetrate the sclera. The sclera is only 1 millimeter in thickness. And so if that needle goes into the vitreous cavity, it could cause a intraocular hemorrhage or intravitreal hemorrhage. It can cause a retinal detachment, and it could cause severe problems inside the eye. So therefore, this is a very dangerous procedure. Now, internet fads will come and go, but if you want to do something to your eye, consult with your eye doctor before doing it. So if it's eye yoga, yes, there's very little harm to that, go for it. But if it's like an eye tattoo or maybe an implantation of eye jewelry underneath the conjunctiva, consult your eye surgeon or an ophthalmologist to discuss the ramifications, to make sure you understand the risks and the benefits before you undergo these procedures. I'm really interested in hearing your comments about different eye fads that you heard, and also your comments about what you saw today and any questions or ideas that you have for me. Please place them in the comments below. Also, remember to like, subscribe, and turn on notifications for further health tips in the future. And until next time, I wish you health. Enjoy.